available from Target, Walmart. It is available pretty much everywhere. Now I'm going to ask him to go live. There we go. Let's see if that worked. You can see I'm not as tech
Hello,
savvy.
hello.
Hey,
How are you? It's good to see you.
so good to see you. I'm doing
What
well. How have you been? New York
I
Times
can't believe it's been
bestseller.
so long. I can't believe it's been so long. It's crazy. I'm gonna turn my light on real quick. I just realized my lighting's not that great here. I thought it'd be
That's
better
okay.
during the day.
I've got the ring light, so the room looks a lot brighter than it really is.
All right, how we doing?
Good,
It's better.
good. Well, thank you so much for coming on. Obviously, we're going to be covering a lot of things gut health, and I'm so excited. And I see you have my book. Thank you for promoting it. I really appreciate it. What do you think? You like it?
Oh my gosh, I think this book is fantastic. And I think it's really cool because so I work as a gastroenterologist. This is what I do all day for a living. And I value and I appreciate the work that you do. And you work with athletes literally all day. This is your craft. And it's really cool because you can see it in the book.
Thank you.
And so, you guys, if you have not checked out this book, Fuel Your Body, great book, tons of recipes, tons of knowledge, plant predominant. And it's ideal for people who are interested in the intersection between nutrition and athletic performance, which, by the way, 30 years ago, the professional athletes didn't pay attention to this.
Mm-hmm.
These days, if you're a competitive athlete, you are paying attention to this.
Yep.
So even on a high school level, but nonetheless, just in general, it's great nutrition advice and it's a good read. So you guys check it out. Fuel Your Body.
I'm honored. Thank you so much. And it's funny, I obviously one of the reasons why I admire you so much is as a gastroenterologist, you recognize just how important nutrition is for gut health. And ironically, I don't feel that all GI docs recognize that. And so I really appreciate just how much you recognize that profound impact that diet has on, and I feel that same way with athletic performance, obviously. And I'm not sure if you know this. I'm sure some of the listeners here today that have heard me on podcasts probably already kind of heard me give my spiel on this, but a huge reason why I got into sports nutrition was from my own gut issues that I experienced as an athlete in high school, and kind of navigating all of these different gut issues that I had, and realizing just how much of an impact nutrition had, not only on ridding me of those issues, but also on my athletic performance. So obviously, here we're talking all about nutrition today, so covering a lot of different topics, but yeah, I'm excited to get started. You want me to start asking you questions?
Well, I just real quick before we started with the questions, I just wanted to comment real quick that like it blows my mind that GI doctors don't acknowledge the importance of nutrition because everything that you put into your mouth goes through the intestines.
Mm-hmm.
And what could be more important, more critical to intestinal health than the dietary choices that we make?
Absolutely.
But going beyond that, I'm also of the belief, and you were alluding to this, Angie, that human health starts in the gut. It's not the only thing that matters, but it perhaps is the most important thing.
Mm-hmm.
And if you want to be the best version of yourself, whether that is living a long, healthy life free of disease, reducing your risk of disease, whether that is having the endurance necessary to be a dad, to be a mom, to live your daily life, to work, or whether that is athletic performance,
Mm-hmm.
it starts in the gut. And so it's hard to be your best if your gut is not in a good place. And that's why I think it's so important to acknowledge that, to pay attention to it, and to nurture it. We should always be nurturing it.
Absolutely. And I feel like people don't realize too how much of an impact gut health has specifically on performance. Even things like hydration, there's an impact there with your hydration levels and your gut health, and inflammatory responses and recovery. There's so much that goes into gut health, and a lot of things that we don't know yet. It's really hard. I always say it's so hard to study these kinds of topics because it's hard to really separate like the diet and the exercise pieces in different research studies. And so you'll see a lot of, the athlete's gut or different articles on this topic. They always say, more research is needed, more research is needed. And so I think it's one of those things we're just constantly learning, more information is constantly coming out. And also a disclaimer that if you're someone listening today, this doesn't necessarily mean that this is advice that we're specifically giving. Oh, 1 second. Looks like he accidentally got left out here. There we go. Just a quick disclaimer, if you are someone who is listening in today, just remember that our conversation is not necessarily specific to your health conditions, and it does not replace a consultation with your healthcare provider. So just want to make sure, because we will be talking a lot about, different GI disorders. There's a question about Crohn's disease and things like that. So, all right, first question, are you ready?
Let's go.
Okay. So like I said, there's a ton of questions about probiotics, but this one is, how do you know when you need to take a probiotic? Do you recommend cycling them or using them continuously?
I think that the most important thing when it comes to probiotics is recognizing the reason why you're choosing to take a probiotic. And so there should be some specific motivation that you have in mind. The vast majority of the time, there are many different reasons to take a probiotic. Some of them are not specifically related to digestive symptoms per se, but the vast majority of people who are going to choose to take a probiotic, it's to alleviate digestive symptoms. So whether that is gas, bloating, distension, constipation, diarrhea, abdominal pain, acid reflux, whatever it may be, you need to first say, okay, this is the reason why I'm choosing to do this. And then the next step should be, okay, let me find the probiotic that is most well studied, most well situated for that specific thing that I just identified as my particular goal. So do a little bit of research, try to figure out, which probiotic has the most research to back it up for that specific symptom. Once you decide what probiotic you're going to try, and sometimes the reality is that you're just kind of throwing mud up against the wall to see what sticks.
Yeah.
So buy a 1-month supply, start it, and see what happens. And if you get better and you sustain that response, there is no reason to cycle. If you have something that works, stick with it. But if it's not working, stop wasting your money immediately. And if you want to continue trying probiotics, one of the things about probiotics is they're all different. So just because one doesn't work doesn't mean that other ones won't work. So if one doesn't work, you may want to try another one. But where I come back to at all times is that the juice has to be worth the squeeze. What I mean is, how motivated are you, and what is the cost? And is the cost worth it in terms of the response that you get? That's really what it comes down to. If it is worth the cost to you, I'm for it, and I would support you.
Now, and it gets really confusing when people are doing their own research too. There's so many different strains of bacteria. So on that question, we're going to kind of take it a next step. Would you recommend that someone get one specific strain, or do you recommend they get a probiotic that has, say, multi-strain?
This is a very interesting question, Angie, and let me be the first to admit that at the end of the day, I'm not here to prove that I'm right or that I'm wrong. I'm here to give you the best available information for today, based upon what I know today. And for me, my clinical practice evolves. I'm not treating patients the same way that I was 3 years ago. So I used to be of the belief that multi-strain is always better. I used to believe that. And as I've moved along, I've come to realize, no, what matters is that you can demonstrate in a study that it actually works. That's what I care about. So more strains will never trump a study that demonstrates that the product actually accomplishes what you're trying to accomplish. So that's why you should always start with that. When it comes to multi-strain versus single strain, you know, there are arguments on both sides. I mean, there really are.
Hmm.
And so I would not say that there's superiority one way or the other. Really, at the end of the day, what it really boils down to is let's use the available evidence. Let's let the science lead the charge. Probiotics can work,
Hmm.
but it has to be the science leading the charge and not the hype. Let's not buy into who has the snazziest advertisements, who's got the influencer that you like that's selling it.
Hmm.
Let's buy into actual research and let that lead the charge.
Yeah. And it's hard because a lot of the influencers that are selling you those probiotics on Instagram, they haven't done any of the research. They probably couldn't even tell you what the difference between the strains that are in that probiotic. So it's a very good point to make. And the next question that kind of is on that same topic is what is the best way to keep your gut healthy if you have to take multiple courses of antibiotics?
So the first question, or sort of the first part of this,
Mhm.
is like if you have to take multiple courses of antibiotics, I would expect that there's a good reason. But the first question is like, do you really need the antibiotics? That's what you should always ask anytime the antibiotics are going to be prescribed. Do I need the antibiotics? What is the benefit and what is the risk?
Mhm.
And let's put it on the scale and make a decision. I do get nervous that antibiotics get thrown around liberally. So the strongest way to protect yourself from antibiotics is to avoid the unnecessary use of antibiotics, which happens way too often.
Mhm.
But if we move past that and we say, okay, a person needs needs this antibiotic, what are we going to do to help to optimize and protect their gut? Here's what we're going to do. We are going to control what we can control. All right, we can't change that you need the antibiotic, but we can change your diet.
Mhm.
We can change how much you sleep. We can change whether or not you drink alcohol. We can change your exercise. Let's take control of the things that we can control. And it's the same concepts that I teach in Fiber Fueled, but it's just now's the time, if ever, to
Mhm.
just be a little bit more attentive to these particular things. Let's eat more plants.
Mhm.
Let's eat those plants in diversity, okay, as many different varieties as possible. Let's make it a point of emphasis. Go to bed early, get at least 7, if not 8 hours of sleep. Let's spend some time outdoors. Let's get some exercise. And then let's not sabotage our gut by drinking. Like, now is not the time for binge alcohol consumption. Now is not the time for high amounts of saturated fat or for sugar. Now is the time to focus on the good stuff and really protect yourself. And then the last thing, Angie, is that if there were a probiotic that I would recommend in this moment, people are always like, do you want a probiotic? There was actually a study that came out of Israel a few years ago that suggested that probiotics actually slow the recovery of the gut microbiome.
Mm.
So you want to be a little bit careful with this. But when I do recommend a probiotic in this setting for a person who is on antibiotics, and
Mhm.
there definitely are people that I do, the probiotic that I recommend is Saccharomyces boulardii.
Okay.
Saccharomyces boulardii. And the reason why is that we have tons of high quality evidence to back up the benefits of this probiotic, this specific one,
Mhm.
when people are taking antibiotics. And it's a yeast,
Mhm.
so the antibiotics don't actually kill it. So you can start taking it
Mm.
immediately.
Fascinating. So interesting. So, so helpful. Um, so I think we did a good job kind of covering probiotics. Obviously, probiotic rich foods are very important too. But I'll be honest, I have a lot of teenage college athletes that are like kimchi, miso, kombucha. Like, no, I'm not doing that. So on that note, I will just mention if you are an athlete and you are looking to take a probiotic, please also just make sure that it is an NSF certified for sport or informed sport product. So make sure there's that third party testing. Dr. B made a really good note about the reason. Make sure you have your reason behind it. The second one was research. And in many cases, that may involve talking to a health professional because research is hard. Research is really hard to interpret, especially as a young athlete. So that's the second part. And then, of course, making sure that it's safe. So on that note, the next question is recommendations for GI distress after eating beans and cruciferous vegetables. What do you recommend?
Yeah, so it's not shocking that these particular foods cause GI distress. And the reason why is because although I am the author of the fiber book, right? So my book is called Fiber Fueled. I'm obviously a fan, but I'm also a doctor, and I understand that there is nuance to everything. You don't just make simple rules and tell people, oh, it's more fiber. More fiber is always the solution. So there is such a thing as too much of anything.
Hmm.
You can drink water to the point of hurting yourself. You can breathe oxygen, not from the air, but if I give you 100% oxygen in the hospital, it hurts you.
Hmm.
So even with fiber, fiber is a beautiful thing, but there is such a thing as too much. And what we need to do is we need to do what our gut is actually capable of doing. So it's just like exercise. If my bench press is, let's just say, 200 pounds,
Hmm.
I'm not going to go to the gym and put 300 pounds on the rack.
That'd not be good.
I would hurt myself, right? And so there's an amount that you're capable of doing in exercise.
Hmm.
There's an amount that your gut is capable of doing if you treat your gut like a muscle. And just like a muscle, it can be trained. So the point is that if you struggle with beans, struggle with cruciferous vegetables, you can train your gut. It can be made stronger. It can become better at tolerating these foods, but you have to back them down at first
Hmm.
to get into that sweet spot where it's like you're exercising, but you're not hurting yourself.
Yes.
Um, with beans, if they are canned, rinse the heck out of them.
Okay. Hmm.
By rinsing them, you are removing many of the gas producing um, polysaccharides.
Hmm.
And if they are dry beans, then you can actually help yourself by soaking them overnight,
Yeah.
discard the water, and bring in some fresh water before you cook them. And then you'll help yourself even more if you pressure cook them. So these are all things that you can do with beans. Now, when it comes to cruciferous, raw cruciferous can be tough for people, whereas cooked cruciferous gets a lot easier. So
Hmm.
just something to keep in mind. We got some legends, by the way. I don't know if you knew this,
I know,
Angie. We
I
got
saw that. Hi, Dan.
Dan Churchill's in the house. Adam Sudd is in the house. Some of my friends. This is great. Hey, guys.
That's awesome. Dan, that's one of my favorite podcasters right there. Really good responses. And I love that analogy of like training the gut. I feel like that applies to sports nutrition so much too. And I work with a lot of female athletes that they go into their workouts just completely fasted. So it's almost like, yes, you can eat a little bit of something. You almost have to train your gut in that same sense, training your gut a little bit with just a very, very small amounts pre-workout. So we kind of talk about the training the gut in a different way, but I like that too with the training the gut as far as, slow increases to fiber. Because obviously if someone is eating 12 grams of fiber a day and here they're trying to eat 40, it's not going to go over too well. So that was a really good example too with the bench press analogy. I love that. Okay, so the next question is about constipation. How to cure chronic constipation with food and or supplement recommendations.
Constipation is a complex topic. I am convinced, like being completely honest, that this is an epidemic. And there are a bazillion people. We got 280 people here right now, and I guarantee you that among the 280, there are many people here who are constipated and they just don't realize it.
Mhm.
And I actually taught a course on constipation exclusively. So no one's obligated to do this, but if you want to, you can check out my course, which goes into more detail than we're going to be able to cover in, 4 minutes during this conversation. But when it comes to constipation, the key is that you have to get into a rhythm. The body thrives on rhythm, just like the heart. If you take the heart and you put it out of rhythm, you could take a great athlete. You could take someone that you work with, Angie. They can't even walk up a flight of stairs, right? And they could be a
Mhm.
great athlete. When the gut is out of rhythm, you are going to feel it. The number one symptom is gas and bloating. Almost every single person who is constipated has gas and bloating. And almost every person who has gas and bloating, when they come to my clinic, the first question in my mind is this person constipated? You could poop every day and be constipated. You could poop 3 times a day and be constipated. You could have diarrhea and be constipated. The reason why is because constipation has nothing to do with how often you poop.
Hmm.
Constipation is the inadequate evacuation of your bowels,
Mhm.
and because it's inadequate, it leads to unwanted symptoms.
Mhm.
And so if you poop every day or 3 times a day, but you are not completely evacuating, then you are backing up. And if you back up to the point that you have a solid column of stool and only the liquid can sneak through the cracks and the crevices and come
Mhm.
down, we call that overflow diarrhea. That's severe constipation. That is the person who has a long history of constipation, and all of a sudden they start having diarrhea and they start taking Imodium because they think they have diarrhea. And the issue is that they actually have constipation. All
Mm.
right. So now that we've established all this, the solution to constipation is number one, you got to get your bowels moving. And number two, keep them moving. So I would make an analogy to a freight train. If you have a freight train and it's sitting on the tracks and it's not going anywhere, imagine the amount of coal that you need to shovel to get that train moving.
Mhm.
It is a lot, right? It requires a lot of energy to get the train moving. That's the person who's actively constipated right now. Once you get that train moving, it's not that hard to keep it moving. That's the person who we just want to have on some sort of maintenance, keep their bowels moving. If you have mild constipation, which by the way are not the people that I see in my clinic ever, they never come to see me. I wish they would. It would be very easy. We could have a fun conversation. But if you have mild constipation, simply drinking some water, doing some exercise, even mild exercise, take a walk after dinner,
Mhm.
and increasing your fiber, those things can be enough to get your bowels moving. But if you have moderate or severe constipation, that is not going to be enough.
Mhm.
And in that setting, I usually don't actually use fiber to treat constipation until I get their bowels moving. Many times what I will do, and again, like as you said off the top, Angie, this is not medical advice.
Yep.
Talk to your doctor about this.
Mhm.
But what I will do with my patients when I'm giving direct medical advice to them is I will jumpstart their bowels with a bottle of magnesium citrate.
Mhm.
So they drink a whole bottle. You take that train, that freight train that's sitting on the tracks, boom, that train is going. All right. And now that that train is going, all right, let's keep it going.
Mhm.
Let's shovel just a little bit of coal every day by taking magnesium. And magnesium oxide is the one that I tend to prefer the most. Typically, I will tell my patients start at 500 milligrams and then gently increase from there. And once you get on a stable dose, you can check your magnesium level with your doctor,
Mhm.
make sure that you're in the therapeutic range and that it's not too high. It usually is not.
Mhm. That is fascinating. Is magnesium oxide the form that's usually in that milk of magnesia?
Okay, good question. So, magnesium hydroxide
Uh-huh.
is milk of magnesia,
Well, there you go.
which is the same thing as magnesium oxide.
Uh-huh.
The difference is that magnesium oxide is the pill.
Mhm.
Okay, so it's a pill, it's a tablet. And if you take that magnesium and you put it in water, which is what happens in your stomach or in your intestines,
Mhm.
all right, it turns chemically into magnesium hydroxide. So they're the same thing, even
Ah,
though they're just slightly different. But um, this is a great point, though, Angie, because there are so many different types of magnesium.
so many different types. Yep.
And I see a lot of people who come to me and they go, "Oh, I'm taking magnesium." And I
Yeah.
look and I'm like, "Okay, you're taking magnesium glycinate,
Yeah.
which is great for
It's great.
headaches."
It's what I
Yeah,
usually recommend for athletes for muscle recovery.
great for
But from a
muscles, great for
constipation
headaches,
standpoint, yeah, headaches, migraines, yep. Hmm.
great for mood, great for
Hmm.
sleep, right? So there's a lot of benefits there, but it's just not good for pooping.
Yeah. Which, on the flip side, if you're an athlete and you're taking a large dose of magnesium oxide for your muscle recovery, it's not going to go over too well. So the
No.
form, the type is very important. Um, okay, so the next question is, what kind of scenarios, if ever, would you recommend your patients supplement with glutamine? A lot of supplement questions. I work with athletes. I get a lot of supplement questions. So this is specific to glutamine.
Real quick, Catalina asks, what about magnesium citrate? Magnesium citrate is also good for pooping, and magnesium citrate can give some of the benefits for like headaches, mood, things like that, recovery, not as much as glycinate. So anyway, okay,
Yeah.
glutamine.
Mm-hmm.
So look, let me say this. I'm gonna start with this. I actually use glutamine myself.
Mm-hmm.
All right. Glutamine is the most abundant amino acid in the body. It's important for muscle recovery to have adequate levels of glutamine. And glutamine is not one of the amino acids that you are required to get from your diet.
Right.
But when you are pushing your body, you may still need some supplemental glutamine
Mm-hmm.
if you are an athlete to help with your muscle recovery.
Yep.
And I
Conditionally
think
essential, I think they call it. Yep.
exactly, yes, conditionally essential. So I use glutamine, and I use it in part to put on lean muscle mass and to help with my recovery. And I love it.
Yeah.
I take 5 grams.
Okay.
If you look at the amount that is being proposed to be taken as a supplement for gut health, it is way more than that.
Mm-hmm.
Minimum of 20, many cases 30 or more grams of glutamine per day as a supplement in addition to what you're getting in your diet. And the problem is that these are short-term studies in specific populations of people, for example, people who are hospitalized in the intensive care unit. Well, that's not the same as the person who plays basketball and is hanging out
Totally.
at home, right?
Exactly. Mm-hmm.
So these are studies in specific populations with extremely high doses, and they're short-term studies. And when you're treating a person in the intensive care unit, you're just trying to keep them alive.
Yeah. Mm-hmm.
We're not talking about long-term gut health in those studies.
Mm-hmm.
And we don't have long-term data at that particular dose. And it
Mm-hmm.
worries me. It worries me that to accomplish this, you have to take it to such an extreme. So I believe in glutamine as a supplement from an exercise perspective
Mm-hmm.
for recovery, for lean muscle mass. But when you like see these little capsules that have glutamine and they make health claims that they're going to enhance your gut health with like the amount that's in a capsule. So you guys, like a capsule is always in milligrams, which means that's a fraction of a gram.
Mm-hmm.
Okay. So that means that you would have to take multiple different capsules to equal the little scoop, the little teaspoon that I do, that's 5 grams per day.
Mm-hmm.
And the 5 grams per day, there's no evidence to suggest that that has any effect on your gut health.
Right.
So I just think that like you guys are being sold a crock of poo
Yep.
because those doses are like little dinky doses that don't do anything.
Right. There's really no evidence that it's going to improve athletic performance. I do, from an athletic performance standpoint, it's hard because, like you said, a lot of the studies are on like those that are in clinical settings. And so you can't take a study like that and say, oh, well, this will work great for a high school volleyball player. Like, no, that's completely different population. And so I will say the one in the athletic setting that I have seen is for ultra runners. So endurance athletes that are doing very prolonged exercise, which we know can actually have a little bit of a detrimental effect on the gut microbiome. So in this case, it can help to protect the microbiome. So excellent response there. The next question kind of on that note is, fiber is so important. However, in some instances, patients are recommended to consume a low residue diet. I remember in my dietetic internship having to handouts on low residue diet. What situations would you suggest this or suggest reducing fiber? Which I know you kind of talked about a little bit in the beginning, but yeah, we'll go for that.
Yeah, so the low residue diet is a very specific dietary pattern, and most of the time, that is going to be a dietary pattern that's going to be a short-term diet. It's not going to be like a lifestyle that you're going to follow moving forward. Now, there are scenarios that I can conjure up that are specific to unique patients. I take care of patients with digestive health problems literally all day. I do this for a living, and I recommend a low residue diet probably 3 times a year.
Wow.
even though I'm like treating, you know, probably a couple thousand patients a year.
Mm-hmm.
So, what are the scenarios? When a person, here's the most common one. You have diverticulitis. Okay. Not you personally, Angie, but like this
Yep.
hypothetical person. All
Mm-hmm.
right. So for the 300 people here hanging out with me, you have diverticulitis. Okay. You have an infection in your gut. Now is not the time to be cranking up the fiber and asking your gut microbiome to do more work than usual. Now is the time to actually rest your gut and give it a break. And it's a temporary thing. So you get diverticulitis, you rest your gut, you go low residue or perhaps even a clear liquid diet on a very temporary basis. We're talking about a couple of days.
Mm-hmm.
You get better, you're feeling like yourself again, and then you start to reintroduce and ramp up the fiber again. Okay, you leave the low residue diet behind you. Number two, a person who has Crohn's disease, all right, if they have a what I would describe as not an inflammatory stricture, and this gets a little bit specific, but like there are strictures in people who have Crohn's disease that are caused by swelling, by inflammation. If you get rid of the inflammation, the stricture, meaning the narrowing, goes away. But if a person has a fibrotic stricture, that is scar tissue, and in that particular person, they have to be careful about the raw fruits, vegetables, whole grain, seeds, nuts, and legumes.
Okay.
Cooked is less of an issue, but raw, you got to be careful because it could potentially get blocked up. So if you have a bowel obstruction caused by a stricture, that's a reason to do a low residue diet.
Mm-hmm.
And then finally, there are some people that have a condition called gastroparesis. And in those particular people, it's not that you like want to eliminate fiber from your diet. You just want to be careful, particularly about raw fruits, vegetables, and whatnot.
Mm-hmm.
So because they can sort of accumulate in your stomach. So you just have to be a little bit careful.
Okay. So that kind of goes back to what you were talking about before with, you know, obviously the cooking to break down a little bit, the cruciferous vegetables, the different tips you gave about beans and so on. So,
Yeah.
On that note, you mentioned Crohn's, and there was one question quick here. What are your top recommendations? I know this is very broad. What are your top recommendations for individuals suffering from Crohn's disease?
If I had one recommendation, like literally you only give me one for people who have Crohn's disease, it is number one, get yourself into remission. All right. So here's why I'm saying this. It sounds so obvious, but I get a lot of people who come and see me and they're like, my Crohn's disease is flaring. What do I eat? But it's the wrong question because if you had like, let's pretend that your microbiome is a forest. When you are flaring your Crohn's disease, the forest is on fire,
Mm-hmm.
right? So let's put the fire out. That's step number one. And then once the fire is out, we can plant some trees, which means change your diet. We can plant some trees and give those trees time to mature and grow, and we can get this forest back. But we all know it's going to take time to rebuild this forest. It's quick to burn,
Mm-hmm.
it's slow to grow it back. And so with Crohn's disease, the approach is get yourself into remission first. Once you're in remission, now is the time to plant the forest. Now is the time to play the long game through diet and lifestyle to get your gut health back on track. Because what you want in the long run, there's no such thing as a cure. But if you put yourself into remission and you are permanently in remission, that's the same as a cure effectively. I mean, it's the best that you can do.
Mm-hmm.
And so get yourself in the remission and then keep yourself in remission with diet and lifestyle.
That was amazing. So helpful. That is about it for the questions that I had here from listeners a few days ago. Besides, of course, I saw quite, look at you showing my book. You're so sweet.
I want to talk about it one more time.
Besides, let's see oh gosh, there are so many questions here about, you know, what brand supplements do you recommend? That's a very common question that we won't even get into today. A few questions here about SIBO. We actually talked about SIBO in our last live that we did together. Some questions here about Crohn's that I think you just addressed as well. Lots of people who love your book. Look at this. Everybody is just loving Fiber Fueled. So yeah, that's it for today. And I don't want to take up too much of your time. Thank you so much for coming on today. I'm going to try to save this. I think I just close out, right? And then it asks if I want to save.
Yeah, it'll give you the option, and you can put it,
Okay.
and then you could add it to your IGTV if you want to, and then you
Awesome.
can share it, and that way I'll be able to share it too. So yeah.
Okay. Perfect.
All right,
Awesome.
before we go, real quick, you guys, fuel your body. I said this in the beginning, but some of you guys weren't here when I was talking about this. You probably want to watch the whole thing again anyway, because we answered a lot of important questions in the very beginning of the session that I think you guys are going to want to check out. That being said, this is the book, Fuel Your Body. Angie is the author. She is the founder of Elite Nutrition. She works, like I said in the beginning, I'm going to say this again. I'm a gastroenterologist. I work with patients with digestive issues all day. This is what I do for a living. This is why I can write a book like Fiber Fueled, because I'm just telling you about what I do, right? Angie can write a book about nutrition for athletes because this is what she does literally all day long.
Yeah.
And so that's why I think this is a great book, and I strongly recommend you guys check it out.
Thank you, Dr. B. You're amazing. Thanks for coming on. Have a great rest of your week. And thank
All
you,
right.
everyone, for tuning in today. All right. We'll talk
See you
later.
guys.
Bye.
Bye-bye.